Joining me to discuss, Dr. Amish Adalja, Senior Scholar at the Johns Hopkins University Center for Health Security. Dr. Adalja, nice to have you back on. Welcome.
Thanks for having me.
Let's start with vaccine. The president is saying that a vaccine will be ready next week or the week after. But as we have the reporting from the scientists, the FDA has not even issued an emergency authorization yet. They've got their meeting December 10th. So realistically, when do you think the first doses will be available?
In the best case scenario, if everything goes perfectly, based on when the FDA committee is meeting, likely late December. And that's going to be for healthcare workers, and it's probably going to be a small amount of vaccine available. So it's not something that we're going to see, I think, in the next couple of weeks or so because of the FDA process and how much data needs to be sifted through to be able to issue, like you said, an emergency use authorization.
And given that what you outlined in December would be the first doses, especially given all the challenges distributing millions of doses of the vaccine, when do you think the majority of Americans would actually have access to it?
Probably mid-2021 if everything goes perfectly. Remember, this is going to be a major logistical challenge, especially if the first vaccine is the Pfizer vaccine, which requires that extreme cold chain that we have to make sure that we keep intact, minus 70, minus 80 degrees centigrade. And that's a lot of planning. That includes freezer farms and suitcase freezers, lots of different moving parts that have to be put into place so that we actually turn this vaccine into a vaccination.
I want to ask you, I was just watching, obviously, Nick Watt's piece, and you saw that shopper at the very end masked in what seemed like more of an empty shopping mall. And it is Black Friday, and people will be shopping, and that is a good thing for the economy. At the same time, we're in the midst of this pandemic. What advice do you have for all of us to stay safe and shop?
You just have to remember that any activity that you do, the virus is going to be there alongside you. So it's common sense precautions, wearing a mask, trying to avoid the most crowded and congregated places, washing your hands a lot. All of that's going to minimize the risk that you have. The risk is never going to be zero until we have a vaccine, but it is something that you still, when you do it, you still have to kind of take the care and realize that we're living in a pandemic, and the actions that you take have a direct impact on whether you acquire this or transmit this virus, and it also has an impact on your community hospital and the doctors and nurses like me who have to take care of people once they get sick. So that it's just about being really careful and trying to reduce the harm that this virus is causing.
Dr. Adalja, there is this new CDC study that says from February through September, only 1 out of 8 COVID cases in the U.S. was recognized and reported, 1 in 8. So what does that tell you about the level of testing that's needed going forward and just the accuracy of numbers of how many people have actually been sick?
Many of us in this field have said from the very beginning that it was a gross underestimate, the number of confirmed cases. And we knew that a virus like this that spreads efficiently through the respiratory route, for which there's no population immunity, was going to kind of have that H1N1 experience. And H1N1 infected 20% of the population within a year in 2009. So we knew that this was a gross underestimate and that we were miscounting. And even my own patients that I remember taking care of early on in the pandemic, when the testing was so constrained, when there was really strict testing criteria, I knew that those were COVID patients that I couldn't count because I couldn't get a test. So we know that this really is a much higher burden than what we've seen reported in the official statistics.
As I'm thinking about this big picture, and Nick was reporting on this, and I know you've talked about this, we won't get an accurate assessment of the numbers after Thanksgiving for another couple of weeks. And at that point, we'll be deep into December, on the cusp of other holidays, and then into winter time. What is your advice to all of us just to mitigate any potential spread as the numbers will rise within our households and our communities?
Like I said earlier, you have to remember that we're in a pandemic and our actions do make a big difference. So if you can try and limit your contacts, if you're at a big Thanksgiving gathering where you saw that there wasn't social distancing, where multiple households were mixing, try and limit your contacts or quarantine yourself if possible. Get a test maybe 7 days after to try and determine whether or not you were exposed during that time period. Continue to wear a mask. Continue to wash your hands a lot. Try to stay 6 feet apart from people. Just behave as if you're in a pandemic. And unfortunately, many people haven't been doing that throughout this pandemic, and that's why we're in the situation that we're in. But it is going to be dark days ahead. After what we saw on Thanksgiving, this happened after the Canadian Thanksgiving about a month ago in Canada. So this is something we all anticipate is only going to get worse as we move towards Christmas.
Dr. Amish Adalja, thank you so much for your expertise. We'll talk again, I have a feeling. Thank you.